Physical exercise is essential to improve your overall cardiovascular health, and it's never too late to start.
Just take a listen to Norwalk Hospital's cardiac rehabilitation manager, who will be here to discuss exercise in your heart on this week's Health Talk.
We're coming up next. Hello, I'm Dr. Eric Mazur.
And I'm Dr. Andrea Peterson. Our guest today on Health Talk is Mary Boudreau. She's an advanced practice registered nurse, and she's the manager of cardiac rehabilitation services at Norwalk Hospital.
Glad to have you here, talking about a very important topic.
Yes, thanks for having me.
Cardiac rehabilitation. We know we've had tremendous success with heart disease in reducing mortality. We see a lot of people living longer even after they've had cardiac events. You do cardiac rehab, so your job is growing.
That's right. That's right.
So tell us, what do we mean by cardiac rehab? What does it involve, and how has that changed from the way we thought about things 30 years ago?
Okay, well, cardiac rehab is primarily a program that patients attend after they've had some sort of cardiac event. So initially, I might meet with this patient in the hospital after they've had a heart attack and go over some education that they might need when they first go home, but we really like to get them into that outpatient cardiac rehab program as soon as possible. Certainly the centerpiece of the program is exercise, and the patients wear a portable heart monitor so that we can monitor them safely. They have a prescription for their exercise, and so they are progressed accordingly to their conditioning level and other factors that come into play.
So this is great news, because I think, decades ago we thought that somebody after having a heart attack, if they had survived it, could do almost nothing.
Well, we wanted to rest the heart so it could heal. That was the thought.
At least for a while.
That we didn't want to do exercise because we wanted the heart to heal.
And now it's a totally different paradigm.
And that's true. When I first started in cardiac rehab, I guess it's over 15 years ago now, the patients did not get out of bed for several days, and then eventually we got them up to walk, and they were often in the hospital for 2 weeks, whereas now they're out within a couple of days. So we really need to get to those patients so that they do know what to do when they go home, and to get them into that cardiac rehab program as soon as possible.
So we know that early exercise is actually important and healthy for the patient, because
Yes.
as we've again learned, put somebody in bed for 6 weeks and they massively decondition.
Right.
They lose a lot of muscle strength, and we don't want that to happen. And the exercise stress on the heart is usually not too bad. But there are some risks, and maybe you could tell about why then a supervised program is important.
Right. Well, certainly after a cardiac event, especially a heart attack, the heart is in the process of healing or recovery. So being able to detect any kind of abnormalities in the rhythm, being able to monitor the blood pressure, which is done before, during, and after exercise, to see how the body is responding to that, and just getting the patient in a habit of doing the regular cardiovascular exercise in a safe setting is really the best way to go about that.
And maybe we can take a step back and talk about the role of exercise in hopefully preventing a heart attack.
Okay. Exercise is one of the risk factors, or lack of exercise, that we can certainly work on for ourselves to prevent any type of heart disease in the future. Exercise, primarily cardiovascular, as I said, has lots of benefits. First of all, certainly when you're exercising, we call the heart a muscular organ, which it is, but really you're exercising your large muscle groups, your arms and your leg muscles, and by doing so, that creates more conditioning and actually promotes better utilization and storage of oxygen, so in so doing reduces the heart's workload. So this is the main benefit right there.
It's an interesting almost paradox, because the other muscles are getting stronger,
Right.
so it puts less stress on your heart to do the simple activities of daily living.
Right, and it strengthens your heart in the long run there. There's also a lot of other benefits. By doing this type of exercise, it helps to promote control of your blood pressure and heart rate at rest. It actually helps to decrease the cholesterol levels and promote increase of the HDL, the good cholesterol. It helps to actually alleviate stress, because the stress, the endorphins are released, which are actually what we call like the feel-good chemicals, which can promote less stress, reduction of anxiety, just a better overall feeling. All of these things that contribute to heart disease.
I think that's a really important point. There's a lot of good evidence linking regular exercise to improved mental health.
Right.
To less depression, less anxiety, and that's true both in somebody who's not had heart disease,
right.
And I'm wondering if it's also true in the patients you see in cardiac rehab.
Oh, it's absolutely true. And you know, often when patients first come into the program, they do suffer from some depression and anxiety. Just the uneasiness of going through something major like this in their lives can have a great impact. But once they get into the program and they start exercising after a couple of weeks, they can really notice when they're done with their exercise session, oh, I feel better, my head is clearer, I'm getting more confidence, so we do see an effect.
And I think,
with that.
again, you've mentioned that it's monitored so that the risks that are there, and we know there are risks, the heart is irritable,
right.
it may have an exercise may trigger an abnormal rhythm. The heart may not respond to blood pressure demands as much,
right.
but you can monitor that and tailor then the amount of exercise for that patient so they don't have those problems.
That's exactly right. So that's really what we do when they're there for their exercise. Cardiac rehab also looks at not just exercise, but modifying the risk factors for heart disease as well. So it's kind of a exercise risk factor modification team approach is what we have for helping the patients recover from their cardiac event.
What's the hardest thing that patients face in your experience? What do you think is we talk about eating better, exercise, stop smoking,
right.
get your blood pressure control, but do you have any personal stories of patients and things that happen to them that really changed their lives?
Well, you know, I think every patient's an individual, so it's a little hard to say. But I think in the way society is today, one of the biggest concerns that my patients have is how am I going to fit this in? How can I find time in my daily life to fit exercise into my schedule? Everybody's worked so hard and is expected to be on at all times. So we help them and coach them to make this part of their routine, and they actually come for 3 months, 36 sessions for their cardiac rehab. So it does become a part of their lifestyle. It's a lifestyle modification. So I would think that would be one of the most...
learning how to take care of you
first.
Right.
Right. The other thing, too, that I didn't mention earlier is that if somebody needs to lose weight loss is not an easy accomplishment. So they need encouragement with that. We have a dietitian on our staff who gives a class on healthy eating, as well as working with the patients on a one-to-one session if they require that. So,
and one of the things we didn't mention before in terms of what exercise can do, we mentioned blood pressure, you've mentioned weight, but it can really help with diabetes control as well.
That's right.
And that can help prevent a first heart attack or prevent further heart attacks if you've had a heart attack.
And let's say the word very explicitly, diabetes is a major, major risk factor.
Yes, it is.
For vascular heart disease.
Right.
Major risk factor. So if you have diabetes and can lose weight and exercise your way out of it, you should do that. If you can't, through those, you should control it as carefully as you can and control those other risk factors very carefully, because it is just such a dominant problem. And with this explosion of obesity, we're seeing also an explosion of diabetes.
Right. Yeah, it's become very prevalent in the United States, you know, diabetes and obesity and how that's all closely linked. And as you said, I mean, heart disease and diabetes, I like to say that they're married because they really go along with each other. So whatever we can do when you tie in exercise into all those things, it's going to have an impact on all of those risk factors that we have been discussing. So,
now we talk about exercise, but we've been very general in talking about exercise. Can you be more specific? What is? I know the American Heart Association has specific goals and prescriptions for exercise, some of which appear somewhat daunting to the sedentary individual. Tell us a little bit about what are those goals and how do you get there in a reasonable way without facing a mountain that just looks too hard to climb and giving it up?
Well, that's true. You know, we don't want people to get overwhelmed who haven't maybe exercised at all or very little before. But the American Heart Association recommends 150 minutes of exercise over a week's time of moderate exercise.
And that's about 20
to 30 minutes per day. Right. So, you know, you have those people out there that are going to go to the gym and exercise vigorously. but you have other people that are just trying to fit exercise into their lives. So even taking a 30-minute walk per day is a wonderful way to fit exercise.
Is a walk enough, or do you have to walk fast enough to raise your heart rate?
That's a good point.
To have that be meaningful.
Right. That's a very good point. You do want to walk briskly, and with any type of cardiovascular exercise, you want to have a continual increase in your heart rate, we like to say. So you want to walk briskly enough to increase the heart rate and the blood pressure, and in a continuous fashion. So ideally, if you can walk 30 minutes straight in a brisk fashion, that's really the best way to approach that. Now, some research has shown that even if you have to break it up into segments, so if you do 10 minutes, 10 minutes, 10 minutes, you still will have benefit from that. So,
and really start where you are.
Exactly. And if there's a concern, you certainly should. If you really should go to your doctor first before you start any type of exercise regimen.
There's some simple ways to increase exercise in your day that you can just build right in, and I've used several of them successfully at times. But parking further away from the store when you're going in, using stairs instead of elevators, looking for those stairs. I think those are easy ways to exercise, which don't really take anything other than the decision to walk away from the elevator.
Right. So anything that you can do throughout the day that you can choose that's going to actually make you active rather than sedentary is a great way to build that exercise into your lifestyle. So it's all about lifestyle modification.
Let me ask you, as a former, current, and intermittently fat person, food for many of us has an unusual place in our lives. It's not just eating to live, but it becomes a reward system. It becomes a way to relax. It becomes a way to escape.
Right.
What do you replace for that as part of successfully maintaining your weight?
Well, we're getting back to exercise again, but certainly when you exercise regularly, it can actually have an effect of decreasing your appetite. And also you're getting that fulfillment of, sort of we mentioned before, feeling better when you exercise. So
when you want that Twinkie, go up and down the stairs a couple of times?
That should do it, Eric. That'll solve that problem.
But I think you're right. I think when people are exercising, they're feeling better. They're feeling better about themselves, and sometimes that can help reinforce.
Right. And they know that they're doing something to help themselves. So if they're exercising, then hopefully they're going to want to modify their diet because they're going to want to be healthy.
And a lot of people, we have less than a minute, but a lot of people don't realize how much they're eating. So do you want to say anything about food diaries or really keeping track of what you're eating? And I think a lot of people would be surprised that they're putting a lot of calories into their body that they don't realize.
They would be very surprised because portion sizes are completely out of control. You go to a restaurant, just in general, people have a different idea as to what a portion size should be. So that is something.
And they're different in this country than elsewhere in the world.
Right. You wouldn't see that in Europe when you go out to dinner. You'd have a nice dining experience, not
a gluttonous experience.
Yes.
Unfortunately, we've run out of time. This is such an important topic. We'd like to thank our wonderfully informative guest, Mary Boudreau, for coming on Health Talk, sharing these tips and ways for you to be healthy at home.
Thank you so much, Mary. And viewers, if you have questions or comments for us, please send them to us at healthtalk@wchn.org.
Thanks so much for watching. Take care, exercise, watch your diet, and
be well.